Hi everyone, my name is Cameron Ormiston, and today I'll be presenting to you my Global Health Senior Honors Thesis, which is focused on the role of cultural practices, values, and norms in type 2 diabetes treatment for Chinese and Japanese immigrants in the U.S. So, focusing on the problem and why we should care, just mainly looking at risk, we see that Asian immigrants have a 60% higher type 2 diabetes prevalence rate than white Americans. And on top of that, they're more than 2 times more likely to have type 2 diabetes than whites, even when having the same BMI. So, even when they have low BMIs, they still have this greatly elevated risk for type 2 diabetes. In addition to the exacerbated risk, there's also this gap in effective culturally competent care due to treatments often lacking knowledge on the patient's cultural context, as well as in research, little attention is really paid to the unique sociocultural factors and contexts within each subpopulation. Asian immigrants are often overgeneralized and aren't looked at, within each subpopulation like Japanese or Chinese immigrants. So that takes us into my research focus. And in looking at the facets of, cultural practices, values, and norms, there are 3 main themes that I really studied. The first one being cultural perceptions, interpretations, and remedies. This is looking at areas like the stigmatization of diabetes, for example, use of stigmatizing language in Chinese immigrant communities, where diabetes is referred to as 小渴, which means a wasting and thirsting disease. So you can already see this idea that's perpetuated where diabetes is this wasting illness, and it's because you have an imbalance in your own internal system and being, and so diabetes really carries this stigma. It really carries on as well into this idea of disease deservingness, which is where patients are, Chinese and Japanese immigrants are really socially conditioned to view people who are sick as being unable to control their will, being unable to control their desires, and so having this disease is really kind of a moral failure. And they not only see themselves as a moral failure, but other people see them as a moral failure. Also within this area, I looked at the relationship between cosmopolitan medicine and traditional medical approaches. Moving on to the family and its influences on treatment, I looked at areas of priorities on maintaining family image and family relations, or prescribed roles in role strain, and whether or not age plays a role. And this really manifested itself in how family and social support is really described as the most important factor in successful disease management. In Japanese families, there's this idea of kodomo no tameni, which is translates to for the sake of the children. It adds really a cultural distinction from Chinese families, and it places this emphasis on grandparents and parents making any sacrifice they can and going to any length necessary to ensure a better life for their kids. But once they have this disease, once they have diabetes, the roles often switch, and the kids are taking care of the parents and the grandparents, and they can no longer fulfill this really important saying for them, this really important ideal. Looking at cultural food practices, I've seen how food is not only the foundation of care, but also the foundation of balance and health. And so prescribed diets are often major barriers to these traditional food practices because they're challenging these ideas of foods that are traditionally seen as medically beneficial or healthy, like rice or meat. And they're saying, you have to stop eating this, you have to constrict your diet on these foods. And so diabetes management really infringes upon these cultural food practices and social expectations, as well as really challenging these ideas of foods that are both culturally and socially important. Looking at social gatherings that involve food, it can really exacerbate issues for patients, where they have to choose between saving face or breaking collectivist norms, where they can either draw attention to themselves and potentially lose family face, or jeopardize their diabetes management. And so it often leads them to choose social harmony and politeness by hiding their diagnosis and eating the food that's served to them. So in conclusion, concluding points and looking ahead, it's really important for clinicians to understand how these cultural facets influence type 2 diabetes treatment, and then subsequently really allowing them to effectively integrate their patient's cultural context into clinical care practice and providing better treatment, and really figuring out how to adapt the care to the patient as opposed to trying to adapt the patient to biomedical culture or biomedical structures. Possible solutions, physicians should really be advocating for balance instead of restriction, figuring out ways to incorporate really important meals and really important foods that are in Chinese and Japanese communities and really incorporating them into their care plan, as well as incorporating the family if necessary and applicable. And also community outreach and education is really important. I'd especially like to thank Dr. Paula Saravia, my advisor. She's been a really great influence and mentor throughout this process as well as throughout my undergraduate career. And then also a big thanks to the UCSD Global Health Program for this opportunity.